may be seated. Greetings. Welcome to Vanderbilt University Nursing 2025 Investiture and Celebration. I am Dean Pam Jeffries, Dean of the School of Nursing, and I have the honor of leading and presiding over today's events. Seeing so many graduates, families, friends, faculty, and preceptors here for this festive occasion is a great pleasure. Investiture is an exciting time, momentous event as it marks the culmination of hard work, the acquisition of new knowledge, and the recognition of new roles and opportunities for our graduates. Today's ceremony has drawn graduates, family, and friends from around the nation. Because Vanderbilt University only holds one commencement ceremony a year, those gathered here today include the August 2024, December 2024, and May 2025 Master of Nursing, Master of Science in Nursing, Doctor of Nursing Practice, and Doctor of Philosophy and Nursing Science graduates. Therefore, some of you just finished your classes and degrees, while others have returned to participate in this amazing investiture. I'm delighted to see all of you and welcome you back to campus. Like you, I have been looking forward to celebrating this day and this day of achievements for some time. Commencement is a joyful occasion, marking the completion of all your hard work, hours of study, months of classes, long days of clinical, and many late nights writing papers or presentations, all while the official conferring of your degrees. So today, you're here at the culmination of all you've worked hard for, surrounded by family and friends who cheered you on, and the faculty and classmates who are beaming with pride at the nursing professionals you've become. We are all delighted to be part of that important day and journey. As befitting a nursing school founded more than a century ago, today's ceremony will be full of tradition. Some may wonder why Vanderbilt calls its graduation ceremonies commencement and investiture. Commencement celebrates the completion of degrees, whereas graduation is the completion of all the degree requirements. Investiture, on the other hand, refers to the formal and public act of conferring authority or symbols of high office. At Vanderbilt School of Nursing, it is when we formally award the symbols of our academic achievements. In this case, academic hoods in Vanderbilt gold and black, trimmed in the apricot of the nursing discipline, to acknowledge your requirement of knowledge and authority as masters and doctorally prepared nurses. This ceremony is symbolic, marking of your passage from a student to graduate, and with it, conferring your responsibility to nursing profession and those you serve. University investiture ceremonies date back to the Middle Ages, as do the academic regalia we wear today. The elaborate academic robes represent the gowns faculty and students, indicating that they were scholars. When universities granted the honor of an advanced degree to its scholars, they adopted the hood as its symbol. The hoods signified the pursuit of scholarly and professional achievements and were designed with distinguishing colors for each school or particular discipline. The investiture hooding ceremony also began in medieval times. The graduates being honored would come before the head of the university to receive a hood from their faculty. In bestowing the hood on the student, the faculty acknowledged that the student was no longer a student, but instead a fellow academic, a master. Soon, you will come forward to receive your hood from the academic director of your specialty or program. With the placement of the hood, your deans, academic directors, and faculty confirm that you have completed the academic and clinical training for your degrees. Congratulations on the very great achievement of earning them. So today, we are honored to be joined by Dr. Karen Cady, System Chief Nursing Officer for Vanderbilt University Medical Center. Dr. Cady is an exceptional and innovative nurse leader who oversees all nursing operations for Vanderbilt Health Systems. Dr. Cady, thank you for being here and for sharing your insight with our graduates. Dr. Cady.
Thank you, Dean Jeffries, for that lovely introduction. Congratulations, graduates. Welcome, family and friends. It is such an honor to be here today. and congratulate you as you graduate. Your hard work has paid off, and now you stand ready to take on the next chapter of your incredible future. I just started as Assistant Chief Nursing Officer about 10 months ago, so I find that this is probably the highlight of my first year here at Vanderbilt, so I so appreciate being here. The highlights of my year here, and I'm going to call this one of them for sure. I've been a nurse for 38 years and in 3 different health systems. Things have changed considerably for nursing over that time frame, but some things are constant. Nursing remains the most trusted profession and one of the most noble and important roles in healthcare. I want to share a story with you about how I eventually found my way to my passion, a career in healthcare. And then I want to tell a story about one of the times, and there were several, when I was on the brink of failure and the steps I took to change the course. My mother was a nurse, and I had always thought I was going to be a nurse. I loved helping people. I loved science. Math, not so much, but we'll come to that later in the story. I wanted to make a difference like all of you out there. Then, in high school, I saw a television show where a nurse inadvertently harmed a patient. This was back in the 80s, and these shows, for those of you of a certain age will remember, they were called soap operas. So you can imagine the drama around this unfortunate event. I was scared, and after that, I doubted myself. I thought the stakes were too high to be a nurse. I imagined myself harming someone due to my extreme lack of inattention to detail. Nursing was going to be too much responsibility, and I never wanted to put anyone at risk. So I turned my back on my profession, and I pursued my passion, and I pursued other avenues, all of which were unfulfilling. Later, I landed in the dentist office as a dental assistant, which brought me back to my healthcare roots, and I realized that what a privilege it was to take care of patients. I decided to go to nursing school and take the risk. Despite how vulnerable I felt, the reward was greater. My passion for being able to care for people and contribute to the health of our society led me back to healthcare and science. Life is never a straight path. There will be wonderful forks in the road where you make choices, and they won't seem like the right choices sometimes. So be gentle with yourself when you make those choices, because in the end, they really were the right choices. They will teach you what your true passion is. The way to find your passion is to find yourself doing something that isn't. Healthcare will provide you with many opportunities and challenges. Take vocational risks. Don't let fear define you. Find your passion. Now, to build on that message, I want to talk about failure. You can't fuel your passion without failure. Falling gracefully requires vulnerability. When I decided to get a PhD, it was for 2 reasons. I needed to round out my skill set. I had a lot of clinical and operational experience, but I lacked the research component that I felt was needed to allow me to lead at the academic medical center. I wanted to be that triple threat. It was also the thing that I thought I couldn't do. Eleanor Roosevelt was always whispering in my ear her famous quote, "You must face your fears, you must do the thing you think you cannot do." I was accepted at the Johns Hopkins PhD program and found myself in a rigorous year-long statistics series at the School of Public Health. I had met my match. On the first test, I got a 52. I had never gotten a 52 before in my entire life. I decided I must not have the right textbook. So I bought every stats book in the bookstore. I got a 64 on the next test. So during that year, I learned that the way to succeed when you're in over your head is to gather your resources. I told everyone I knew that I was failing statistics. And at the time, Dean Jeffries was faculty at Johns Hopkins School of Nursing, so she must have known I was failing. I went to every lab, I met with faculty, and I ripped through 3 tutors until I found one who could help me run my fancy calculator. He actually had a cat who was on dialysis and was in dire need to fund his vet bills. As a cat lover myself, and one who at once had, 5 cats. Now hold your crazy cat lady comments because I'm down to a respectable number now. I was eager to find a way for both of us to reach our goals. He became my statistics tutor, and I funded the cat's dialysis. We both won. I passed statistics, and the cat got a few more years. When you find yourself facing failure, don't be afraid to be vulnerable and ask for help. Innovation, empathy, accountability, crucial conversations. These are all critical skills that we need in healthcare, but they also require vulnerability. Your ability to be vulnerable can sometimes be your greatest strength. So find mentors, resources, family members, friends, many of whom are right here with you today, who will shepherd you through those difficult times. Those were the people who pushed me to do the things I thought I couldn't do. They opened doors and they helped me shape my career. People want to know how they can support you. Let them know and then celebrate your success with them. What you have learned here at Vanderbilt will follow you forward. We will count on all of you to train and mentor the nurses and the nurse scientists of the future. Take vocational risks. Don't let fear define you, and then find that passion. And by doing that, you'll leave your legacy. As you go out into the world, I wish you the best, and I hope that you always stay connected to our school and come back and share your successes. As I know there will be many, and they will be of great magnitude. You can count on us for support and a lifelong academic, clinical, and leadership connection as you navigate an amazing careers that are ahead of you. I know that I speak for all of us today, and that we are so proud of what you have accomplished and so excited to see what you're going to do next. So congratulations, class of 2025. Thank you, and best wishes to all of you. Now, I'd like to welcome Dean Jeffries back to the podium.
Thank you, Karen. Your words about staying connected to Vanderbilt are wise and valuable. I echo her words and encourage all of you to keep in touch with Vanderbilt School of Nursing and your fellow classmates. I know you've formed friendships that are forever. I spoke earlier about the origins of academic regalia and the history of our ceremony today. Now I would like to talk a little bit about tradition, not as old, but one that dates back to 1877 and the founding of Vanderbilt University. Each year, Vanderbilt awards a gold medal to the top scholar in each of its 10 schools in honor of the founder, Cornelius Vanderbilt. This year, Vicki Nicholas, an adult gerontology primary care graduate from Orlando, Florida, is the School of Nursing's founder medalist. Vicki, will you join me, please? She comes up, I'll say a little bit about Vicki, because we had our Founders Day ceremony yesterday and wanted to also do it again today. But Vicki embodies the hallmark qualities of a Founders Medalist: top grades, innovative scholarship, exceptional practice, and service to her family, patients, and community. Her path to Vanderbilt and her master's degree can be credited to her drive and compassion, qualities instilled in her by her aunt, Adeline, a Haitian immigrant who raised Vicki and her brother after they were orphaned at a young age. Her aunt, a certified nursing assistant, believed that a fulfilling life required a commitment to service. Vicki says her aunt not only gave her a sense of family and cultural identity, but also gave her a sense of hope and ignited an insatiable desire to help others through her healing. Vicki is dedicated to improving care for vulnerable populations and expanding access to health care in high-need areas. While at Vanderbilt, she participated in several key initiatives, such as the HRSA-funded Advanced Nursing Education Workforce, ANU, grant program designed to enhance clinical practice in underserved and rural communities, and the Vanderbilt Mobile Vaccine Program. The latter was especially meaningful to her as it allowed her to begin building relationships with the communities she planned to serve. Through her clinical training, she developed an expertise in addressing the social determinants of health and gained practical experience in interdisciplinary collaboration. Vicki has taken and passed the national certification to be a board-certified AGPCNP. She now holds an advanced practice registered nurse licensed in the state of Tennessee. This means she's able to work as a nurse practitioner. She's currently applying to postgraduate training programs and seeking employment to provide quality primary care service to patients ages 13 and up by utilizing trauma-informed care, narrative medicine, and a collaborative team approach to assist patients on their healthcare journey. Vicki, I am proud to present you the 2025 Founders Medal for the School of Nursing. Please join me again in a round of applause for Vicki Nichols, the School of Nursing Founder Medalist. And I know her family is out there. I met them yesterday, so kudos to you as well. Before we move to the hooding portion of our investiture ceremony, I would like to also recognize some of our distinguished members of the VUSN class of 2025. This first group is those graduates who are active duty military or veterans. We respect and value the service provided by our veterans and the perspectives they bring to our programs. Their life experiences, leadership abilities, and critical thinking make them outstanding classmates and students. Would all those graduates who are veterans or active duty personnel please stand so we can recognize you? Thank you. We thank you for your service to the country, as well as your choice to pursue nursing as a profession. Also, for some of our family and friends here, our nursing traditions and symbols are unfamiliar. You may wonder what this purple cord I wear represents and others that you see. It signifies that the person wearing it is a member of the Sigma Theta Tau, the International Honor Society for Nursing. Sigma is a long-established and respected organization focusing on scholarship, leadership, and service. To be invited to join Sigma, graduate nursing students must have completed at least 1/4 of their program and have a 3.5 GPA. Graduates, if you're a member of Sigma, would you please stand and be acknowledged? And faculty, you can stand too. There's Sigma. All right. Yes. So congratulations to all the students who are Sigma Theta Tau members and well as our faculty. Finally, there is one more group I would like to recognize at this time. Vanderbilt School of Nursing has an outstanding and selective PhD program in nursing science for nurses who desire to transform the discipline of nursing through scientific discovery. Students come from across the country to study with our faculty and develop their scholarship and research areas. They have been members of our VUSN community for several years, coming to campus for intensives and events before embarking on their scholarly careers. At Vanderbilt, PhD degrees are conferred by the graduate school that we had this morning at 11 o'clock, rather than the individual schools like the School of Nursing or the College of Arts and Science. The graduate school held that separate commencement ceremony during which new PhD received their doctoral hoods and were recognized for their significant accomplishments. This year, 4 stellar nurses earned PhD in nursing science degrees from Vanderbilt. Dr. Angie McNeilis, Assistant Dean for the PhD in Nursing Science program, will have the privilege and honor of introducing them to you. Each graduate will be hooded by the respective dissertation chair, along with Dr. Ruth Kleinpel, Interim Senior Associate Dean for Academics. Dr. McNeilis?
Thank you, Dean Jeffries. Our first doctor is Dr. Vera Marie Borkowski, whose study is titled Informatics Resources for Social Determinants of Health in School-Based Health Centers. Dr. Borkowski will be hooded by dissertation chairs Drs. Alvin Jeffrey and Marianne Piano. Dr. Borkowski was also awarded 2 awards that we would like to acknowledge: the University Graduate Fellowship Russell G. Hamilton Scholar Award and the National Institutes of Health F31 Predoctoral Individual National Research Service Award. Dr. Amy Campbell, whose study is titled The Experiences of Mothers Feeding Their Autistic and Neurotypical Children During Infancy, a Qualitative Study. Dr. Campbell will be hooded by dissertation chairs Drs. Julie Barroso and Mulibran Mogos. Dr. Emma Clark, whose study is titled Associations Between Midwifery Regulatory Environments and Maternal Health Outcomes. Dr. Clark will be hooded by dissertation chair Dr. Jeremy Neal. And Dr. Janine Yeager-Stone, whose study is titled Using Momentary Assessment to Measure Insulin Habit Automaticity and Factors Associated with Insulin Adherence. Dr. Stone will be hooded by dissertation chair Dr. Sheila Mulvaney. We would also like to acknowledge Dr. Stone being awarded the Dean's Award for PhD Student Excellence in Writing Award and the PhD Alumni Award. Family, friends, and other honored guests, please join me again in acknowledging Vanderbilt's 2025 PhD in Nursing Science graduates. Now I will ask Dr. Terry Allison, Assistant Dean for Academics of our Doctoral Nursing Practice Program, Dr. Ruth Kleinpel, and Dr. April Capu, Associate Dean for Strategic Partnerships and Global Affairs, to come forward to present our Doctor of Nursing Practice graduates.
Dr. Terry Allison, Assistant Dean for Academics and Professor, will hood the graduates of the Doctor of Nursing Practice program. Dr. Allison Lindsay Anderson, whose project is entitled Improving Care in Older Adults with Traumatic Hip Fracture Through Early Mobility. Dr. Nicole Monique Arrington, Enhancing NP Residents' Empathy for People Living with ADRD Through Virtual Reality Simulation. Dr. Lillian Noella Bassian, whose project is titled Improving Nurse Engagement by Implementing Shared Governance. Dr. Leah Bergman, whose project is titled Measurement of Preoperative Pediatric Anxiety Using the Modified Yale Preoperative Anxiety Scale. Dr. Andrew Scott Biesinger, Reducing Physical Restraint Use Through a Multimodal Intervention in a Trauma Step-Down Unit. Dr. Eunice Jacqueline Blanchard, whose project is titled Inter-Rater Reliability of the Monk Skin Tone Scale in Healthcare. Dr. John Andrew Bourgeois, whose project is titled Return on Investment for Ultrasound-Guided Peripheral Intravenous Cannulation. Dr. Nancy Choate Brownlee, whose project is titled Targeted Antibiotic Prophylaxis Before Prostate Biopsy. Dr. Carolyn Grace Chance, Improving Provider-Led Management of Type 2 Diabetes in a Rural Clinic Using a Knowledge Assessment Tool. Dr. Ari Hunter Chaskis, Assessing Emergency Department Staff's Preparedness to Respond to Disaster. Dr. Charlotte Louise Capizzi, whose project is titled Evaluating the Need for Advanced Practice Providers in the Pre-Hospital Setting. Dr. Patricia Mai Chun, whose project is titled Implementation of a Novel Nurse Faculty Mentorship Program. Dr. Jessica Lilly Crimmon, whose project is titled An Evidence-Based Protocol for the Emergent Intrapartum Transfer from a Birth Center to a Hospital. Dr. Catherine Reed Delarocco, whose project is titled Evaluating Post-ED Follow-Up Appointment Scheduling Process. Dr. Maureen Carolyn Diesman, Improving Provider Understanding of the Effects of Marijuana on Adolescent Mental Health. Dr. Tia Sheedan Falls, Increasing Smoking Cessation Efforts in Urology Oncology Patients. Dr. Christina Stamatia Busolis, whose project is titled Improving Clinical Nursing Leadership Skills in the Novice Psychiatric Nurse. Dr. Taylor Madeline Gassman, whose project is titled Support for Caregivers of a Child with Autism Spectrum Disorder Diagnosis. Dr. Mary Beatty McLaughlin Gibbs, whose project is titled Resumption of SBIRT Screening at Marshall Student Health, Observing Outcomes After COVID-19. Dr. Kathleen Groff, whose project is titled Paid Maternity Leave for Infant, Mother, and Employer. Dr. Ashley Christina Jackson, whose project is titled Effects of Intentional Mentorship on Transition to Practice for New RNs. Dr. Cameron Jordan Jackson, Improving Patient Satisfaction Scores in the Emergency Department through Whiteboard Communication. Dr. Brian Daniel Kaminsky, Jr., whose project is titled quality improvement project to decrease incidence of delirium in older adults who undergo orthopedic hip fracture surgery. Dr. Ellen Suhasini Leiter, whose project is titled Resilience Rising, a 6-week wellness program for healthcare professionals. Dr. Tammy Gale Lucas, development of a coworker observation reporting system, implementation toolkit for nurses. Dr. Sarah Nicole Massini, whose project is titled Impact of Nurse Engagement on the Coworker Observation Reporting System. Dr. Reagan Elizabeth Maroney, improving nursing and provider knowledge and comfort managing dyspnea in cancer patients at end of life. Dr. Lauren Marie Motis, impact of gender-affirming hormone therapy on depression screening scores in gender-expansive individuals. Dr. Kimberly Charette McAnderson Carter, whose project is titled Sustainability and Replicability of a Medical Fitness Model in Obese Patients with Diabetes Mellitus Type 2. Dr. Taryn Martine McCoy, whose project is titled Evaluation of Social Determinant of Health Interventions Among Foreign-Born Populations. Dr. Jennifer Kathleen Mitchell, whose project is titled Developing a Transition to Practice Program for Novice Primary Care Nurse Practitioners. Dr. Julie Turner Moyes, whose project is titled Point of Care Ultrasound by Advanced Practice Providers in an Emergency Department. Dr. Lupita Morgan, whose project is titled Perceived Barriers in IR Scheduling. Dr. Kathy Simmons Moss, whose project is titled Nursing Informatics Competencies for Nurse Leaders. Dr. Jennifer Marie Natalie, whose project is titled Quality Improvement in Transition Care, Addressing Gaps in Readiness Assessment for Adolescent and Young Adult Patients. Dr. Daphne Grace Penenza, whose project is titled Team Communication and First Case Starts in the Neurosurgery Setting. Dr. Haley Elizabeth Puckett, whose project is titled Facilitators and Barriers to Center for Patient and Professional Advocacy's Coworker Observational Reporting System Program. Dr. Lisa Roddy, whose project is titled Virtual Reality Immersion Mindfulness Technology. Dr. Tracy Lee Salvitz, whose project is titled Interprofessional Education to Improve Team Performance. Dr. Victoria Rose Smith, whose project is titled Educational Course on Nature Therapy and Nature Prescriptions for Healthcare Professionals. Dr. Phoebe Shaw Trifoli, whose project is titled Impact of Teamwork and Communication Training on Team Psychological Safety. Dr. Ashley Page Tuttle, whose project is titled Advancing Health Equity, among female veterans by improving breast cancer screening utilization, a quality improvement initiative. Dr. Christina Wiley, whose project is titled Educating Providers on Workplace Breastfeeding Policy. Dr. Kaylee Alexandria Williams, whose project is titled Increasing Patient Satisfaction Ratings and Outcomes Using Adaptive Group Therapy. Dr. Brent Tyler Young, whose project is titled Patient Satisfaction with Medication Management in Home Hospital. Dr. Rachel Leigh Zeevy, whose project is titled Paperless Discharge in the Emergency Department. I would now like to welcome Dr. Angel Anthematten, Associate Professor, who will now acknowledge our Master of Science in Nursing graduates.
Dr. Leslie Hopkins, Academic Director, will hood the graduates of the Adult Gerontology Primary Care Nurse Practitioner Program. Sharifa Latoya Dixon. Yu Hao Hu. Vicky Nicholas. Wesley Victoria O'Donnell. Alawana Smith. Dr. Julia Steed, Academic Director, will hood the graduates of the Family Nurse Practitioner Program. Amber Renee Bonema. Bailey Booker. Jenna Claire Eggleton. Mallory Newkirk. Paige Angel Roberts. Dr. Jennifer Wilbeck, Academic Director, will hood the graduates of the Family Nurse Practitioner Emergency Nurse Practitioner Program. Paul William Bailey. Carrie Kobos. Emily Marie Jonas. Dr. Colleen Moss, Academic Director, will hood the graduates of the Neonatal Nurse Practitioner Program. Jennifer Gardner. Instructor Tanya Moore Davis will hood the graduates of the Nurse Midwifery Program. Emily Grace Apadula. Rachel Michelle Brubaker. Kaylin Carroll. Carlise Ariana Denhart. Mackenzie Lou Deslover. Kaylee Marcella Evans. Delaney Muriel Hartman. Simona Paige Hellinger. Jillian Hoyt. Krista Nicole Korkowski. Alicia Maria Mana. Chloe Grace Penton. Lindsay Blake Pulliam. Caitlin Schulmeyer. Instructor Tanya Moore Davis and Academic Director Dr. Julia Steed will hood the graduates of the Nurse Midwifery Family Nurse Practitioner Program. Naomi Nova. Morgan Andrews Peterson. Jalexia Cheyenne Skinner Fisher. Emily Linnell Stewart. Sullivan Patricia Waskoski. Bridget Rachel Wells. Rochelle. Anne McQueen Watley. Amanda Therese Zeta. Dr. Debbie Arnault, Academic Director, will hood the graduates of the Nursing and Healthcare Leadership Program. Samantha Jo Beringhouse. Dr. Susan Alexander, Academic Director, will hood the graduates of the Nursing Informatics Program. Amanda Corey Gatto. Laurie Louise McFetridge. Michelle Palacios. Chui Ying Sim. Dr. Kim Stinson, Academic Director, will hood the graduate of the Pediatric Nurse Practitioner Acute Care Program. Megan Buckler Dickens. Dr. Brittany Nelson, Academic Director, will hood the graduates of the Pediatric Nurse Practitioner Primary Care Program. Angelica Sarandi Anthony. Wala Adnan Bahur. Morgan Drew Creel Garello. Karen Michelle Jones. Assistant Professor Dr. Rosevick will hood the graduates of the Psychiatric Mental Health Nurse Practitioner Program. Kristen Marie Anderson Gonzalez. Gianna Elizabeth Basil. Adam Hope Dockery. Taylor Catherine Guzzi. Dane Gordon Polton. Sasarika Muthuswamy. Kara Danae Sharp. Professor Shauna Parker, Academic Director, will hood the graduates of the Women's Health Gender-Related Nurse Practitioner Program. Carly Ryan Austin. Allison Olson. Kennedy Parham. Academic directors, Professor Shauna Parker and Dr. Leslie Hopkins, will hood the graduate of the dual Women's Health Gender-Related Nurse Practitioner Adult Gerontology Primary Care Nurse Practitioner Program. Brianna Maxine Schnell. Please welcome Associate Professor Dr. Carrie Plummer, Interim Co-Director of the Master of Nursing Program, to the podium to acknowledge the Master of Nursing graduates.
Dr. Jennifer Kim, Professor and Interim Co-Director, and Dr. Ruth Kleinpel will hood the Master of Nursing graduates. Meredith Grace Scott Archer. Cassidy Morgan Ballard. Kaya Luihi Sylvia Bota. Abby D. Brummett. Olivia Mills Kane. Namneet Dother. Hannah Ashley Foster. Hannah Michelle Harwell. Erica Michelle Holloway. Aaliyah Hope Jackson. Taylor Knowles. Mary Noor Lafloof. Madeline Maylin Lee. Haley Genevieve Martin. Grace Catherine McCormick. Caroline Mullen. Hannah Elizabeth Nightingale. Robert Province Quinn. Kiana Marie Reinert. Alicia Siddiqui. Abigail Tanko. Kushernia Tao. Belsin Badangshu Sagi. Jordan Charmaine Volpita. Michael Joshua Weiss. Jessica Gershek Williams. Laurel Taryn Yetter. And now I would like to welcome back to the podium Dean Pamela Jeffries, who will give her final remarks.
Can we give our graduates another round of applause? Woo! Class of 2025. Thank you. Thank you to everyone. That went quick, didn't it? All the graduates. Anyway, as I said earlier, commencement is an acknowledgement of the graduates that have completed all the requirements for their degrees. It is also when degrees are officially conferred. As Dean of the School of Nursing, I have the honor of presenting our students who have earned the degrees of Master of Nursing, Master of Science in Nursing, Doctor of Nursing Practice, and the Doctor of Philosophy and Nursing Science. They have fulfilled all the requirements established by the School of Nursing and on recommendation by the faculty have been conferred that academic degree. On behalf of Vanderbilt University Chancellor Daniel Diermeyer, I hereby confer your degrees. Another round of applause. At this time, family, friends, and other honored guests, I present to you the Vanderbilt University School of Nursing Class of 2025. Woo! So today is the culmination of months and years of hard work and sacrifice by you and your loved ones. You came to Vanderbilt seeking knowledge, experience, and advanced degrees. You could have selected an easier path, but you didn't. You chose to learn at the Vanderbilt University School of Nursing, where rigorous academic and clinical standards are the norm. You chose to learn from the Vanderbilt's world-class educators, clinicians, and researchers. Now, you are ready to take your place as nurses with advanced degrees, responsible for delivering unsurpassed patient care, and as doctorally trained nurses, bringing evidence-based knowledge into practice and improving healthcare outcomes. As Vanderbilt nurses, you know there are large, complicated challenges facing healthcare in our country and around the globe. They include provider shortages, societal issues, limited access to healthcare, unmet mental health needs, and the rising cost, just to name a few. Yet, I am optimistic about the future of healthcare because of today. There are 29 new Vanderbilt Master of Nursing graduates educated and prepared to join our workforce. There are also 324 new Vanderbilt Master of Science in Nursing graduates taking their places as nurse practitioners, nurse midwives, nurse leaders, and nurse informaticists. And there are also 60 new nurse leaders who have earned the Doctorate of Nursing Practice degree. And there are 4 nurse scholars with new PhD in nursing science degrees starting careers advancing the discipline and practice of nursing through research, education, and health policy. With all this, I'm very optimistic about the future of healthcare because of you. All the members of this class, the MNs, MSN, DNPs, and PhDs, have many things in common: excellence, dedication, intelligence, accomplishment, and hard work, only to name a few. Today, you have joined the ranks of 13,000 Vanderbilt School of Nursing alumni worldwide who make a difference in healthcare. You too will make a difference to your patients and your families, your coworkers, employers, the workplace, and our nursing profession. You will change lives. You are Vanderbilt's answers to society's healthcare challenges, and we have them. Not because you are so very needed as providers, but because each of you is a nurse leader, equipped to ask the hard questions, identify the problems, find the best solutions, discover knowledge, and lead the discussions that will revolutionize healthcare delivery. And as you go forward as providers, nurse informaticists, nurse leaders, nursing faculty, nurse scientists, and doctorally prepared nurses, I urge you to be confident and patient-focused. Embody compassionate care. Seek out problems to solve. Advocate for your patients and your profession. Keep learning. Embrace science. Be bold in your ideas and creative in your implementation. On behalf of our deans, program directors, faculty, and staff, I would like to take a final opportunity to congratulate you. You've put tremendous work and passion into the accomplishments we celebrate today. You're an extraordinary group of capable of making exceptional contributions to healthcare. Vanderbilt's stated mission is to bring the best in humanity, and I have faith that our wonderful educators have prepared you to meet that challenge. Wherever your journey leads you, know that Vanderbilt School of Nursing community commends you, wishes you well, and takes pride in all you do. Thank you. So now, one more round of big applause for the 2025. So now the exciting part for the reception, because this concludes our investiture ceremony. I invite all the graduates and guests to join us at a reception to celebrate the significant accomplishments. Our faculty will recess out first, followed by the graduates, so please wait for the recessional to finish before you follow us to the reception area that's in the tents out and back. So again, congratulations 2025, Vanderbilt School of Nursing. Thank you.